Coming up on the FSR Sarc Fighter Podcast.
The road was kind of moving in my vision. My heart was pounding. I had the weirdest sensations in my body. And I just was like, I don't feel right. I don't feel right. I don't feel right. And so my son was in the front seat. He's like, Mom, you need to get over that. You need to get over. You need to get onto the side of the road.
Heidi Sedra wasn't just feeling bad. She was feeling awful, like stay in the ICU awful.
They panicked. They had to intubate me. They had to do a bunch of emergency stabilization techniques. They found what they thought was a collapsed lung on the right side.
This is the Sarc Fighter Podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hello and welcome to episode 165 of the FSR Sarc Fighter Podcast. I'm John Carlin, your host. Date of this recording is June 9th, 2026. And I hope you're feeling as well as you can be today, as I like to say, and also that you're feeling hopeful, because that is what we try to do here on the FSR Sarc Fighter Podcast, is we want to give you hope. Now, I got to brag for just a second, speaking of hope, because my phone is buzzing right now. I'm getting texts. I have my two oldest sons, and in fact, my son Jonathan has been on the show. He did a fundraiser for FSR. They are both, they're the Super Carlin brothers. And if you are a big fan of Harry Potter or any of the Pixar movies, that kind of thing, my sons have a very, very popular, in fact, they make their living from their YouTube channel. And the reason I'm bragging a little bit right now is I'm getting pictures because they were invited to the red carpet for the premiere of Toy Story 5 in Hollywood. And they're there right now on the red carpet. So who knows who they will meet, but a lot of Hollywood stars are expected to be there. And, for small town guys like us, that's kind of a big deal. And my phone is buzzing and everybody's all saying, holy cow, and so forth, because they're showing themselves they're there. They're actually inside the theater right now. And from the looks of things, they are there maybe even a little bit ahead of the crowd. So cool, and I am just so proud of my guys. Speaking of that, you've all been very patient with me in describing my recovery from the Achilles surgery that's now been 6 months ago, after what I call the great pickleball accident of 2025. If you remember, I lunged for the ball, and the rest was history. My leg gave out, and bada boom, bada bing, there I was. Well, you may recall also that I'm training to do a ride across Virginia in celebration of the state and the nation's 250th anniversary, and the ride is scheduled to end in historic Yorktown, Virginia, on the 4th of July with the fireworks. That all sounded so great when I signed up for it, like the middle of last year, right? Oh yeah, we're gonna train. We're gonna ride across Virginia. I know there's mountains, for the first third of the ride, but we ride in the mountains. We'll be okay. Well, now here I am staring this thing down, and I'm starting to question my sanity for signing up for a vacation that scares the crap out of me. And I mean, I am seriously having second thoughts. And if we hadn't already paid a fair amount of money to join this tour group that we're going with, I might bail. Now I'm just thinking, just do the best I can and hope it's not too painful, and hope that it is in fact actually doable. It really is the first 3 to 4 days when we are in the mountains as we ride from the Kentucky border all the way through Roanoke, where I live now, and then all the way on into Richmond, and then Williamsburg, and then over from Williamsburg to Yorktown. Those are nice flat rides and not too serious. for the training that I've had. But this past weekend, we went out and we did do a 100-kilometer ride. That's 62 miles. And I finished, along with my wife, Mary, and the other couple doing the ride with us. I will say that the three of them were a lot more chipper when the ride was over than I was. I was almost too tired to eat afterward. This ride finishes at a restaurant that we really like up in the mountains. But for the record, I did eat. I ate the appetizer and then half of a meatloaf sandwich, and I ate the other half for dinner. So I know you are on the edge of your seat just wondering how much I could abuse myself as I try to maintain some semblance of being a serious cyclist. Holding on as long as I can, folks. That's all you can do. I'm just holding on. All right. I have a great guest today. Heidi Sedra is only about 2 years into her battle with sarcoidosis. And I got to tell you, until recently, sarcoidosis seriously had the upper hand. She has been through it all, especially the part about finding the right diagnosis and then making her way through all kinds of the various medications and therapies. Some of this will sound familiar to you if you have been in the sarcoidosis space for very long. And the kicker of all that is that Heidi's a nurse practitioner. She sees patients herself, and she is going to share how maddening it is for her to have to schedule doctor's appointments months out, even when they know she's sick. You've been through this, right? You pick up the phone, you call, and you say, I can't get out of bed, or my loved one can't get out of bed. There's something wrong. And the doctor says, yeah, we can see you 2 months from now. And, there she was, and she's going to tell the story. She couldn't walk without a walker. She couldn't work. Nobody knew what was wrong. And just like the rest of us, she had to wait in line. I mean, you'd think you would know somebody, right? Hey, Heidi who works here, or Heidi who's a doctor here in the area, nurse practitioner. We got to squeeze her in somewhere, and she is really, really sick, and she has really had she's had a tough go of it. But I think she's turning the corner. She contacted me. She really wanted to share her story, and Heidi joins me next here on the FSR Sarc Fighter Podcast.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter Podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter Podcast. Welcome back to the FSR Sarc Fighter Podcast, and joining me this morning is Heidi Sedra. Heidi is up early this morning. She lives in Washington State, not too awfully far, Heidi, as I understand it, from the Pacific Ocean. Is that right?
Yep, that's correct. Yeah, it's about a 30-minute drive for me.
Okay. Well, Washington State is just beautiful. I love it out there in the Pacific Northwest. And so you're very fortunate. I see a lot of trees behind you and that kind of thing. So it looks like you live in a peaceful environment.
Yep. Living rurally to enjoy all the greenery that this rain brings.
Yeah, that's right. Because it's all a big rainforest, isn't it, up there?
It is. Yeah. We're actually about an hour south of the Hoh rainforest,
Okay.
which is just an incredible place. Very green, just gorgeous.
Great. Well, unfortunately, you have found your way into the sarcoidosis community. So I'm glad to have you here, but at the same time, I'm sorry that you've had to find us.
Yeah.
And you can speak with a little bit of authority. Can you tell us, because you have a lot of medical background and you're a nurse practitioner?
Yep. So I got my start in healthcare when I was about 20. Well, actually, no, that's not true. 18 years old. I started as a nurse's aide. My first job was actually helping out at my mother-in-law's adult family home as a caregiver. So, of course, she wasn't my mother-in-law yet at that point, but that was where I first got my start. And then I worked my way up through the ranks as a nurse's aide, a medical assistant, an RN at the bedside doing critical care, and then decided to go to graduate school about 15 years ago, and then got my nurse practitioner degree. So so I've been working in internal medicine for my nurse practitioner career.
So I've always been curious about where the dividing line is between an RN and a nurse practitioner, and then a nurse
Yeah,
practitioner and an MD. Where are those
yeah.
lines? Yeah.
Yeah, so in terms of training for a registered nurse, there's a couple of pathways to become a registered nurse. You can get a 2-year degree at a community college. That's usually referred to as an ADN, which is Associate's Degree Nurse.
Okay.
Or you can go to a 4-year university like I did at Gonzaga, and I did a 4-year Bachelor's of Science in Nursing degree. And so
Okay.
that's the foundational training to get to the RN degree, and then to test to sit for the national boards, the NCLEX. And then that designates you as a registered nurse in our country. That's how that part works.
Okay.
And then if you decide to go back to school and you want to become a advanced practice nurse or registered nurse practitioner, there's actually lots of different pathways. We're fairly specialized now. It wasn't that way when I went to school back 15 years ago, but it's pretty specialized now. You pick a track. You pick either family nurse practitioner, acute care nurse practitioner, gerontological nurse practitioner, peds, acute care. There's so many different tracks now. Back when I went to school, there wasn't that many options, so it was a very general degree of family nurse practitioner. And it's a 3-year graduate program. Whereas for a physician, they go to school and get their 4-year degree in either chemistry, biology, kind of, physics, whatever they want to
Hmm.
study. My undergraduate degree was in nursing.
Okay.
And so then once you hit that medical school stage for a doctor, they go to medical school and do 4 years. So our program's 3 years, theirs is 4. And then when we're done with our training, I always tell people to think of us having done our residency in reverse,
Hmm.
because we were a bedside nurse already, got our nursing degree. We've already got a lot of bedside experience, whereas the baby doctors who are just graduating med school, they're just entering into their residency then.
Got
And
it.
yeah, so it's
Yeah.
kind of just a different focus, but we absolutely, in Washington State, we have full practice authority. So it's been that way for a long time here. We're independent. We have our own malpractice insurance, our own licensing. So
Gotcha. So when
yeah.
somebody goes to the doctor, they can come see you, and you can
Uh-huh.
do pretty much anything that a doctor could do, I guess, up to a point, right?
Up to a point, yeah. So I do not do surgery. There are some nurse practitioners. I have friends that are in surgery, nurse practitioner
Really?
friends that are first assist in surgery with a surgeon. That's what they do. That's their job.
Yeah.
Um, there's a variety of positions and routes to get there for nurse practitioners, depending on your specialized training and experience. The beauty, I think, behind being a nurse practitioner is I can bounce back and forth without having to go back to do a new residency, whereas a physician has to kind of start over and do another residency if they want to change their field. So I bounce back and forth a lot between the hospital and outpatient internal medicine through my career. That's what I've done. So,
Okay. So, first of all, congratulations on all of that.
oh,
That's
thanks.
amazing. You've,
Yeah.
and I'm sure you have helped a lot of people. But now, so let's pivot a little bit and talk about how all of a sudden you found yourself needing help. When did you start feeling badly? And we're speaking here in June of 2026. So, how long ago?
Yeah, so it's actually coming up on the 2-year anniversary. Um, June 14th, 2024. I woke up that morning, just was a normal day off for me. Husband happened to be off that day too. And I woke up and I did not feel quite right. Tried to go to the bathroom to just, you wake up, you go to the bathroom. I could not urinate. It was the strangest feeling. I thought, well, this is really weird. Having a lot of, I know I had like a lot of body pain.
Mm.
Just woke up in a lot of pain, and it was really strange. So I thought, okay, something I never do. I was like, I'm just going to get in this shower here and loosen up. Maybe something's tweaked, and my bladder's just not able to empty or something. So get in the shower, still feeling terrible. Get out of the shower, try to go to the bathroom again, and it's just bright red blood. And I thought,
Oh,
oh
wow.
boy, okay, this isn't normal. I need to go to the emergency room. I felt kind of shaky and lightheaded. I just did not feel well. So my husband rushed me over to our local critical access hospital because we do live rurally.
Mm-hmm.
They were wonderful. They've always been wonderful. Um, they ran me through some tests. They said, we think you just passed a kidney stone. And I thought, well, that's strange. I drink a lot of water. I have a healthy diet. Okay, well, this is new. Didn't really think much of it after that. They sent me home, told me to rest, fluids, antibiotics, just in case it tried to stir up an infection. They didn't see any remaining stones in my kidneys, so they said seems like it was just a one-off. You should be good. Okay, great. So I come back home, and this happened to be my first day off for a stretch, because when you work in the hospital, you're on for a long time and off for, usually equal amount of time, like 7 on, 7 off, that kind of thing.
Mm-hmm.
So it was just the start of a run of days I was going to have, I think, 4 or 5 days off. Had some things planned, and just tried to take it easy. So the 17th of June, a few days later, myself, my daughter, my son, and my mother-in-law, we were headed up north to Auburn for my niece's college graduation. She was graduating from the community college up there. And we're just going along, and I was driving and not feeling my greatest, but I was okay. And all of a sudden, it felt like I was drunk behind the wheel. And I hadn't obviously not been drinking. Like, this was just so bizarre. The road was kind of moving in my vision. My heart was pounding. I had the weirdest sensations in my body. And I just was like, I don't feel right. I don't feel right. I don't feel right. And so my son was in the front seat. He's like, Mom, you need to get over that. You need to get over. You need to get onto the side of the road. So we pulled over to the side of the road, and just felt like I was going to pass out. It was such an unusual feeling. I thought, well, maybe I'm allergic to this antibiotic they gave me. You think of all of these things.
Yeah,
Like, yeah,
you're medical personnel. You're, nurse
yeah,
practitioner. You're just like, okay, you ought to be able to self-diagnose,
exactly. I'm
right?
like, what in the heck is going on here? And it was an antibiotic I hadn't had before, because again, I've been blessed with pretty, good health. So I thought, this is just weird. All right. So kind of lay down in the back seat. Thank goodness my kids are older. So my daughter took the wheel. She drove us home. We skipped the graduation. There was no way I could really sit up. And of course, my daughter, she's in nurses training now, but at the time she was doing her prereqs for nursing. And she's like, Mom, I think you should probably go to the emergency room. And again, I'm like, I'm fine. I was just there. This is an antibiotic issue. I'm sure of it. It's going to be fine. It wasn't fine.
Yeah, yeah, no kidding.
So I rested overnight, and then I had to go back to work the next day. And so I did, and I seemed okay. I thought, okay, everything seems to be fine. I'll stop taking this antibiotic, and I'll talk with the doctors at work today, see what they think. Well, I didn't even make it really that far. I think it was probably by 8:30 in the morning at the hospital, trying to do rounds on the floor. I was up on the 11th floor trying to see patients, and I went white as a ghost, and one of the nurses was like, "Oh my God," got a wheelchair, took my vital signs. My blood pressure was through the roof, which I've never had an issue with.
Wow.
And heart rate was like 150. And they're like, there is something really wrong with you. You're going. And that was kind of the beginning of the journey. I ended up admitted
Yeah.
to the hospital. They did a bunch of cardiac tests. They tried to figure out what was going on. And it's interesting too. This is the hospital I work in. So the people who know me around there, they see me running around all the time.
Yeah.
They know I like to backpack on the weekends. They know that I'm like, traveling the country to go do hiking, and they don't see me as this unhealthy person, right? So they're like, "Oh, you're fine. Maybe it's hormones. You're getting to that mid 40s. Just go home and rest, take some time off, talk to your primary care."
Right.
Okay.
Yeah.
Okay, fine. And then I never had another one of those episodes again in the hospital, of course. So I come home, I try to, rest up for like the next week. I think I was home for about 10 days, tried to go back to work again. And then all of a sudden comes these neurologic symptoms of feeling like I'm drunk, but not behind the wheel, just walking around in the hospital.
So,
I,
so describe that neurologic symptoms
yeah,
like you're drunk. So you're like just
yeah.
staggering.
Yeah, I was like staggering. I couldn't like quite keep myself up. I was having to grab to the wall to help keep me, up so that I didn't fall over.
Yeah.
And then that would be kind of with intermittent increased heart rate. And I thought, this is just the strangest stuff ever. And I kept having this really bad neck pain too. And I thought, okay, well, some years back, I was told I had a pinched nerve in my neck. Maybe that's, what's going on. Maybe I need to go, talk to them about that again.
Mm-hmm.
Just didn't really understand what was going on. So I thought, okay, I'm done with this. I'm going to go home. I obviously need to take some time off. So I kind of applied for a leave of absence and went through that process of working with my doctor to try to figure out what's going on. And initially they thought it was that pinched nerve. They, got me in to see neurosurgery again and that did the MRIs and all of these things. And meanwhile, I'm having these tachycardic spells where my heart rate just randomly goes up to like 150 for no reason, just sitting here.
MRIs didn't show anything.
So it did show that I still had that old kind of compressed disc in there, but
Okay.
there was no entrapped nerve. There wasn't anything that was like a smoking gun for them.
Right. Okay.
So I thought, okay, well, waiting in the outpatient world these days to get stuff done, I'm sure you're aware, it takes forever. It takes forever to get a referral to go through.
It's awful. It's awful.
It's terrible. You wait and wait and wait. And so that's kind of what I was stuck in, this waiting pattern. And I thought, well, I'll do massage therapy. I'll do acupuncture. I'll do these things I know I can do.
Wow.
Go get an
I just have to say your journey and mine are so similar. Okay, but go ahead. Yes. Like I'm hearing acupuncture, massage, I did it all. Yep. Keep going. Sorry.
Right at all.
This is sounding familiar.
Yeah, yeah. And lovely practitioners. They were all great. Acupuncture actually made things worse.
Okay.
When they started, like, I think I went in for my third session and the poor lady was like, I need to call the ambulance because here I'm sitting with a heart rate of 160,
Oh, wow.
I said, no, 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 it's okay. I just need to lay down. And this is what's weird, John. Every time I would do this, if I laid down on my right side, I would feel better. And the heart rate would eventually slow down if I was on my right side. And that's why I thought, okay, this has got to be that pinched nerve in my neck. Somehow it's interfering, with my heart.
Were you still thinking it's some sort of a mechanical malfunction?
Yeah.
Okay. Yep.
Still thinking it's mechanical. And so my daughter actually had to come pick me up from the appointment because I couldn't drive. And she said, okay, we're going to wait for an hour. And if this doesn't go away, I'm taking you back to the emergency room. I thought, okay. So it went away, of course. It calmed down and everything seemed to be fine again until we got to, I think it was about July, oh gosh, I don't know, July 15th or so. So I was, at home trying to do this with outpatient stuff, waiting to see neurosurgery again. And I woke up another morning and just everything hurt. My chest hurt, my abdomen hurt, my armpits hurt, like everything hurt. And my heart rate wouldn't come down. I think it was like 4 a.m. And I told my husband, I said, you have to take me to the emergency room at my hospital. Let's get on the road because it's about a 45-minute drive.
Oh, really? Okay.
Yeah. To where I was working, in the city in Olympia. So I said, we've got to get there because something's terribly wrong. And sure enough, they scanned me. I had perforated my bowel.
Why?
Yeah, I know. So I had had a history of diverticulitis, kind of been an ongoing on again, off again issue.
All right.
Pretty common problem. Lots of people have it. Um, but it just came out of nowhere. And then it was apparently so bad that it had caused a perforation of the bowel at this point.
Huh.
It was very tiny though, so they didn't have to do surgery. They just kept me in the hospital for a week and did, IV fluids and didn't let me eat, that kind of a thing. And so since I was there, stuck there for this issue, they could see that my heart rate was doing crazy things. They could see I couldn't walk. They could see I'm like falling over and stumbling. And they're like, what is going on? And these are people I work with, and they know me
Right.
as a healthy, active person. So hence
Mhm.
all of the consults. They had neurology come see me. They had all these people come see me. I mean, I had the entourage. I had like the best care. And they still didn't catch it. They still didn't figure out at that point what was going on. It was so frustrating. Unfortunately, then got sent home again after that week
Didn't
stay.
somebody say, let's do a brain scan or something like that?
They did, John. They did a brain scan, and my spot, which we now are pretty sure is a granuloma in my brain. They said, "Oh yeah, no, that's just a meningioma. That doesn't have anything to do with what's going on."
Okay.
Lots of people get these meningiomas, it's an incidental finding. It's not related. I'm like, okay, okay. Yeah, it was
That all tracked for you with your medical background. So you're like, I
sure.
feel like crap, but that's not it.
The most likely explanation was definitely not that
Yeah.
meningioma. So,
Right.
oh man. Anyway, hindsight's 2020, right?
Sure.
Yeah.
Sure.
So I come home again, and then we're working into August, I think, at that point. And I go see my primary care provider. She doesn't even recognize me at this point. I mean, I've got a walker. I've got, my kids having to drive me.
Really?
I couldn't stay upright because I'm just like on a boat, on a boat, on a boat. The only time it felt better is if I would take a leave or ibuprofen. So that was kind of the first
Huh.
clue something inflammatory was going on, because those are anti-inflammatory.
Anti-inflammatories. Yeah. Yep.
Yeah. So I thought, okay, well, I'm going to talk to my doctor. We've got to do something else. This is crazy. And I mean, I'm trying to think of anything possible. And I go in there and I say, I have probably been obsessed with this because I feel my life being hijacked right now. And I said, if you look at my chest scan, one of the chest scans they did looking for a blood clot in my lungs when I was inpatient in July, I
Yep.
said, it's really weird, but Dr. Tui, why do I have enlarged mediastinal lymph nodes? Why did that CT scan say enlarged mediastinal lymph nodes? It's in the chest, and
Right.
hilar lymph nodes. Like, why would that happen?
So you are a real life Dr. House right now, right?
Yes,
Yeah.
yes. I was
Like you
like,
know you know enough to ask the next question, and you're trying to
exactly.
track down this mystery.
So in my training as a nurse practitioner, I've been trained. There's a handful of reasons for that to happen. That handful of reasons being lymphoma, of course, we all know that one now that's
Sure.
been through this journey. Uh, Atypical fungal infections, like maybe like HIV patients would get. Sometimes you can get those lymph nodes to react. Metastatic cancer, but no one found any nodules or anything,
Right.
or sarcoidosis. And I said, I don't know how any of this is going to connect. And, by this point too, from all the inflammation for so long, my brain wasn't working right. Like my clinical brain couldn't process the information like I normally would. It wasn't firing. It wasn't clicking. I was so sick. And I said, can you just explain to me why? Like, why this? And she says, no, I really can't explain that to you. She said, why don't we go ahead then and refer you to pulmonology? Great.
Okay.
Sounds great. So this is like mid to late August. And I said, something else that's weird. I said, this weird red spot that showed up here near my elbow when all of this began. And at first it was itchy and burny. I thought it was a bug bite.
Right.
Uh, I said,
Right.
it hasn't gone away. Like, what's that? Do you think that could be connected? And she says, maybe let's refer you to dermatology. Okay.
Okay.
So I leave, and she says, keep taking the ibuprofen as long as your tummy can handle it. Go do these things. Okay, will do. And so I head off to the dermatologist. I think I finally got that biopsy a month later in September, and it comes back at the end of September. Took a while, and it shows a non-necrotizing granuloma. And I said, "Oh my God, that's sarcoidosis."
So you knew that from your medical training. Okay.
Yep. I knew
Okay.
that piece.
Yeah.
I'm like, this is crazy. Okay. So it's affecting my skin. I wonder if that's the lymph nodes. It must be my lymph node. That must be what's causing that too. Still not understanding how any of these pieces fit together though, at all. Had
So
no,
so that's the first time the word sarcoidosis comes to your mind.
yeah, yeah.
And you didn't immediately say, "Oh, let me take some prednisone and see if this thing on my elbow goes away."
No, because the dermatologist removed the whole thing and
Oh,
sent it off because she was suspicious enough too. Listening to my story and what I had been going through, she
okay.
was suspicious enough too. So she actually removed the whole lesion. I even had a couple of stitches after she got it off
Okay.
of
All
there.
right.
Yeah. So it and so yeah, so I thought, okay, well, this has got to be good news. Let's go follow up with primary care doc again. And she says, yeah, she says, let's get those results over to the pulmonologist. Maybe it'll help speed things up and get you seen sooner.
Mm-hmm. Because
It
even
really,
you can't cut the line.
nope. Mm-mm.
Ah,
No, nope, no way of doing it. It was just so frustrating and just
yeah.
waiting and waiting. And, and not being able to go to work and not being able to really do much around here at the house. It was very frustrating. Watching all of the summer plans get canceled one by one. I mean,
Mm.
that was just that was heartbreaking. And I know all of us, have kind of have gone through that. It's just that part's so hard. Uh,
Mm-hmm.
so the next step then was going to follow up with the GI doctor from the perforated bowel, did all of the scopes and everything. And unfortunately, when I was there to have that done, they saw one of my tachycardic spells, scared them half to death. My heart rate was up in the 170s. They were thinking, oh, she must just be anxious. And I'm like, really? No, I'm a pretty laid back, chill person. This is just what my heart keeps doing. And we don't know why. So it scared the dickens out of them. Had that all done, and it comes back all these biopsies they did, and they said you are inflamed from your esophagus to basically to the anus, like my whole GI tract, because
Wow.
they did upper and lower scopes. And I said, well, just add it to the list of mystery findings right now, because I have no idea why sarcoidosis would do that to me. I
Mm-hmm.
That doesn't make any sense to me at all.
Mm-hmm.
Still doesn't make a lot of sense to me. National Jewish helped clarify it a little bit, but of course they put me on the acid reducers and all of these things. I'm like, but I don't have heartburn. I don't understand.
Well, people were trying to treat something they didn't understand, so they're
Hmm.
just like, let's treat the symptom,
Hmm.
right? And
Yep.
then but nobody knows the underlying cause yet.
Yep. Yep.
And I'm sure those the acid relievers did nothing to help you, right?
No.
No, of
Didn't help
course
with
not.
the inflammation, of course not, because that wasn't what was causing it,
Right,
obviously.
right.
So, uh, that was just wild. So I think then finally that brought us up to, I think, October of 2024. And then in November, I finally got to sit in front of a pulmonologist. I think it was like the first week of November in 2024, and kind of went through everything, same thing, let him know, what was going on. And at this time, I had also seen my neurologist that had helped me with the pinched nerve in my neck here locally, rural neurologist, great, Dr. John Miller. I mean, he is just fantastic.
Yeah.
He was the one too. I think eventually, once the biopsy came back on my elbow, he says maybe that meningioma is a granuloma. So he was thinking this is probably going to be way out of my normal range, and we need to start thinking about weird stuff for you now. And I thought, okay, well, we're trying to get him to pulmonology. We're
Yeah.
trying to get the biopsy, there and everything. So he kind of was pushing too to try to help expedite, and it just didn't matter. The system's so backed up and
Everywhere. Everywhere.
everywhere. I know.
Ah,
I, it's crazy.
I
So
hate it.
I end up there at pulmonology and the guy's like, well, it's kind of a long shot, but okay, let's do it. Let's get you checked out. You're obviously quite disabled now by these symptoms.
Mm-hmm.
I think at that point too, I started with physical therapy, occupational therapy, just anything to try to help me stay mobile and maintain muscle mass,
Mm-hmm.
because I really didn't know what else to do. And I couldn't just sit on the couch. That wasn't going to be effective either. So they were a great help through the whole process too. But yeah, it was November before I finally saw pulmonology, and the poor guy, he couldn't even get me in to get pulmonary function test done before my bronchoscopy to get the biopsy of the lymph nodes. And so he's like, well, let's just get you in, let's get this done. So I finally go in. No, the day of infamy for me,
Yeah,
December 13th, Friday the 13th.
of course. Of course.
And of course, my husband and I are just joking in the pre-op area because I'm pretty like superstitious. And so,
Right?
being in nursing, you're always worried about the full moon and Friday the 13th.
Yep.
So, so my husband's joking, and the poor doc, he's just looking at us like, are you guys crazy or what? Like, no, we're fine. We're just joking about it being the Friday the 13th. I wasn't scheduled originally to go in Friday the 13th. They called me to let me know they had a cancellation, and I took it. It's kind of
Okay.
like, I need to get better. Like, I need to go. I go in, it's like 5 a.m. I go back first case for this bronchoscopy, and it does not go well. It does not go well at all. We're supposed to be
Wow.
in and out and to a birthday party for my daughter that evening. Like, this is a normal, like, routine in and out.
Yeah.
It did not go well. I unfortunately went hypoxic, meaning my blood oxygen level went very low during the
Ooh.
procedure. They panicked. They had to intubate me. They had to do a bunch of emergency stabilization techniques. They found what they thought was a collapsed lung on the right side, a known potential risk. So for having a bronchoscopy with
Yeah.
biopsy. So they put in a chest tube while I was still asleep in the procedure room. The chest tube didn't fix it. So then they started doing some other maneuvers with the ventilator to try to get my airway to open up so I could oxygenate, because I was not oxygenating. It's like, you were just blue. You were not coming up. You were not improving. And I'm like, oh my gosh, this is wild. So I then transferred to the ICU. I was intubated for the whole day and in the intensive care unit. And
Are
around
you
6,
conscious at this point?
no,
No.
no,
Yeah, when
no.
you're intubated, you're not.
Mm-mm.
They put you under.
They put me under.
Okay. Okay. I mean,
Yeah.
that's
Yep.
probably should have
Yeah.
been a foregone conclusion, but okay. Yes. Go ahead.
Yeah. Yeah. Put me out, put me in the intensive care unit. I started to come around. I think it was about 6 o'clock p.m. I'm looking around and I'm going, this isn't the PACU. This is not where I should be. I know this hospital inside and out, right? This is where I've worked for years. And I'm like, I'm in the intensive care unit. What is going on? I'm just like big-eyed, tube still down the throat,
Mm-hmm.
kind of like trying to figure out what's going on. My husband's looking at me and he's like, oh, thank God. He thought I was a goner. He thought she's not coming back from this. Like, they've really done
Really?
her in. Like, she's been so sick and now she's just gonna die. I mean, him and my daughter were just so sure. A little bit of background history there too. Every time they've seen someone in the hospital in that situation in our family, they have died. So they've
Okay.
got a little bit of PTSD on that,
I get it. Yeah.
that
Yeah.
side. So it was pretty traumatizing for them. And obviously for me later, as I started to pull through all of this. But yeah, so I ended up with a collapsed lung. Then I ended up with a torn airway. Somehow, when I was extubated, my airway was torn, and then air got in around my heart and my lungs. So they call it a pneumomediastinum, pneumopericardium. So there was heart pushing on, or air pushing on my heart and air
That
pushing on
was
my
from when
lungs.
they pulled the tube out. They were not
That's
gentle enough, right?
They're assuming, yeah, that it had kind of adhered to the airway.
Okay.
So, and you know how with the sarcoidosis, you're just dry. Everything's dry all the
Yeah.
time. I don't know if
Hmm.
that you've experienced that, but a lot of
I
drying.
have not. I haven't, because I'm neuro
Yeah,
only as
right.
far as I
Yeah.
know. So yes.
Yeah.
So okay. So you survived that,
I
Has
survived
has
that.
anybody yet said you have sarcoidosis?
Not yet.
Not yet.
No, and in fact, it's so sad. Of course, they apologize profusely over and over again for having to be in the hospital and in the ICU and all that. They're just like, "We're so sorry this happened to you. We're so sorry this happened to you." Complications that happen, but still, even one of my favorite pulmonologists I've worked with for years sent patients to him in the outpatient setting, sent patients to, consults when I'm working in the hospital. But he says, "Sister, your lungs, there's something unusual there." He says, "But I don't think you have sarcoidosis. This is going to end up being something else, And I was like, "Well, then what? What do you think it is?" "I don't know, but it's going to end up being something else." And I thought, okay, well, this is a guy I know I've worked with for a long time. He's really
Sure.
sweet. So, sure enough, though, I come home the next day and the pulmonologist who had done the procedure calls and says, I can't believe this, but yes, this is a non-necrotizing granuloma. It's definitely sarcoidosis. There's some other staining they do to make sure it's not infection. And of course, all of that came out normal too. He says, so this is not an infection. This is definitely sarcoidosis. And I was like, thank God, can I please have some steroids? I'm dying here. Like, please help me. Because those tachycardic spells were still happening,
Mm-hmm.
almost
Mm-hmm.
daily. All of these things are still happening. And he says, but your PET scans in a couple of weeks. Let's wait. Because he had preemptively ordered the PET scan,
Yeah.
knowing of the
And
backlog.
so he was afraid if you start on the steroids, the PET scan would not see the full reading.
Correct.
So now you got to deal with whatever you're dealing with for 2 more weeks.
Exactly.
So you get a
So
clean reading. Okay.
mhm.
Yep.
In the intensive care unit, backtrack just a little bit, but when I was there in December, that 13th to 20th or whatever that stay was, they did give me some IV steroids at that point because of the suspicion for sarcoidosis.
Mm-hmm.
And because I wasn't doing well. And they thought, okay, well, maybe it's pulmonary inflammation, maybe it's just good old fashioned lung inflammation, and that's why
Yeah.
she's not oxygenating. So I can't remember how many doses, but I think ended up with 4 or 5 doses of IV steroids before they stopped them. So anyway, but yeah, we ended up getting the PET scan done. Really, the lungs were definitely affected from that.
Mm-hmm.
They didn't see anything cardiac, but it wasn't a dedicated cardiac PET scan. I don't think anyone really thought about that with the tachycardic spells. I don't think they really understood how the symptoms may be connected at that point either.
Mm-hmm.
And they didn't really see any other areas. So I was thinking, okay, good. So this is just going to be one of those like isolated pulmonary cases that went to my skin, that we're going to be good. This is going to be fine. And then maybe it's just the inflammation that's causing all these other random weird things. By the time then, though, I followed up with all of my entourage of providers at that point and got those referrals out to neurology. They wanted to send me off to Johns Hopkins. My pulmonologist wanted to send me up to University of Washington, and then my primary care wanted to send me to National Jewish. So that's kind of
So yeah, they've decided, okay, we've done all we can here. You got to get to a bigger medical center of some kind.
Yeah.
Okay.
So they knew that they were dealing with something. They couldn't put the puzzle pieces together either. And so I met some really nice doctors up at University of Washington. They put me through the ringer. They did the cardiac PET scan. They did the cardiac MRI. But unfortunately, John, at that point, I had been on steroids then since like December 30th. So
Okay.
we're talking February. So I've been on like 8 weeks of steroids. All of those testing essentially came back pretty normal, with the exception of some scarring on my heart that they couldn't explain.
Mm-hmm.
And
So
it was,
the steroids are giving them a false reading because they're doing their job and they're shrinking all of the
yeah,
inflammation.
exactly.
Yeah.
Yeah. Yeah. So they're seeing like this little linear scarring on that MRI. And they said, yeah, that's kind of like those lines of granulomas. That's kind of how sarcoidosis likes to perform or likes
Mm-hmm.
to, be. So they saw that. And then they saw, of course, my scarring in my lung. It's in that right upper portion. And so they said, well, let's get you on methotrexate. Let's try to get off these steroids. Kind of started going down that.
Are you on like 60 milligrams of steroids at this point?
They tried to start me on 50.
Uh-huh.
I didn't sleep for 3 days.
Of course not.
And I said, I can't. You guys, no. I feel terrible enough. There's no way. I can't do
Yeah.
that. So I think they had given me 20 milligram tablets and I was taking 2.5. That was the prescription
Okay.
to get to 50. And I said, I'm just going to try taking, 1.5. So I'm going to try 30. I'm going to see if I can at least do that.
Right.
And I did okay with that. Then I was at least getting like 4 hours of sleep at night.
Although I found when I was taking the prednisone, and I complained to my doctor, I said, I can't sleep. And he said to me, it's not sleep you'll miss. And because when you're on the prednisone all day long, you don't get tired because you're on prednisone, right? So he's like, you're not getting any sleep, but 4 hours will probably be enough.
Yeah.
I believe that's what he meant, but I found it to be true. Anyway,
Yes.
that's an
I
aside, and probably a vast majority of people listening to this podcast have experienced prednisone, so maybe that's interesting or relevant to them. But
yeah.
so you dosed yourself down,
I did. I
and
knocked it down to
yeah,
30 and I told him I said I just can't. There's no way, guys. I can't do that. And 30 seemed to be okay. It was controlling my symptoms. That's what was beautiful about it.
mm-hmm,
My heart finally calmed down.
mm-hmm,
My feeling like I'm a drunken sailor trying to walk around, that quieted down. It wasn't happening hardly at all. If I didn't get any rest though, or I was really tired or at the end of the day, those neurologic symptoms were starting to come back. But I was having other neurologic symptoms too that we didn't really touch on. I was having a numb left arm. I was having a numb, left leg. So I'm stumbling around with these numb limbs. And then I was having some difficulty with my bladder and my bowel. And in fact, they noticed that in the hospital.
mm-hmm,
I just was back to not really being able to empty my bladder, just
mm-hmm,
like my first symptoms, but no
mm-hmm,
kidney stones and no bleeding. So they speculate that it had to do with the peripheral nerves that help with those functions, that they were just so inflamed they couldn't, perform their functions properly.
hmm, hmm.
So
But so the prednisone did or didn't fix that?
it definitely helped a lot.
Okay, yeah.
It helped a ton. So everything did start to slowly feel better. Um, the methotrexate transition, they kind of go down on the prednisone as they go up on the methotrexate.
Yep.
Had a hard time with that. I think probably most people have. It's really tough because then you get like sort of this increase of your symptoms again, and then a few days later they maybe go back down. It doesn't quite hit the same with the methotrexate.
Yeah.
And then I start having those, like flu-like symptoms with the methotrexate.
Yep. Yep.
Just
Just
gross.
like the malaise kind of.
Yeah.
Yeah. I didn't tolerate methotrexate well at all. All right. So so at some point you get to your specialist hospital, and you had shared with me in your email when we
Yeah.
first started talking that this podcast actually helped you find
Yep. Yep.
National Jewish Health. Can,
Yep.
can you tell me that story?
Absolutely. So after going up to University of Washington and working with the lovely doctors up there, they couldn't connect the dots either to these neurologic symptoms. And they weren't gone. They were improving, but they weren't gone. And they were definitely not as well controlled on the methotrexate. So as I was going down on the prednisone and up on the methotrexate, I'm starting to have more issues again. I'm having to actually straight cath because my bladder can't empty itself just randomly.
Mm,
And the kind of the memory cognitive processing, it was getting worse again. And so I thought, okay, and the numbness, that never changed
mm-hmm,
in the left arm and the left leg. So I thought, okay, well, we got to figure out something else. And they said, yeah, we're not really sure what to do either. So they had me see their neuroimmunologist up there, Dr. Personair, amazing physician. He typically works with MS patients there at the MS clinic.
mm-hmm,
And, of course, at first, everyone was thinking that, this is like when I very first got sick, like maybe this is an MS, maybe it's a Guillain-Barré syndrome, maybe it's all these things. And
yep,
it never ended up being any of those things. So it made sense to be there with a specialist that deals with these types of illnesses. And he said, he says, your clinical exam is very strange. It doesn't make sense to me either. He said, maybe that thing in your brain's a granuloma. He says, but I think you have sarcoidosis in your peripheral nervous system. He says, I think it's affecting your peripheral. So not the nerves in the spinal canal, off the spinal canal, but out into the periphery. And he said, that's not what I specialize in, because MS is a disorder of the central nervous system,
Right.
not the peripheral nervous system. And he's so specialized up there, right?
Yeah.
He says, you really need someone like, Dr. Tabby at National Jewish. You really need someone there. He, I think, had known about her work because he trained at University of Colorado. And so same Denver area, right? And this is where Dr. Tabby was practicing at that point. And so I thought, well, this is like serendipitous, because my primary has actually referred me there. So a referral process has already been started. I just didn't think about engaging with that because of the situation up north at University of Washington. I was like, well, we got in there first, so that's what we're going to do. But I said, that's so weird that you mentioned this, because then not only that, I was just listening to a podcast with Dr. Tabby on the Sarc Fighter podcast, and he's looking at me like I've got four heads. I don't think he had any idea what the Sarc Fighter podcast was. And I said, he's got neurosarcoidosis, and his name's John, and he's great. He has all these guests on, and things are starting to make sense now. And I said, I think maybe, I just really need to go see this Dr. Tabby that was on his show, because she seems like she really knows what's going on. And he says, he said, I think they call it parasarcoidosis. Now that's the first time I heard that word. So parasarcoidosis is kind of like the name for all of these other symptoms that you get from the inflammation. So for whatever reason, the sarcoidosis causes our bodies to be in this hyperdrive inflammatory state. And they think it might be responsible for the generalized body aches, for the brain fog. And then for me, for this numbness that I'm having in the left arm and the left leg, it's just damaged those peripheral nerves.
That's the first time I've ever heard the word parasarcoidosis.
Yep. Same for me. It was the first time I heard it from this very specialized expert. And he said, I think they now call it, though, non-granulomatous manifestations of sarcoidosis. And so sure enough, with the help of your podcast, piecing some of these puzzles together and hearing Dr. Tabby, and I'm just going, oh my gosh, that's me. Oh my gosh, that's me. Oh, this is great. This is who I need to go talk to. I did eventually, in April of 2024, make it to Denver with my sister and my mother-in-law in tow to babysit me, because I can't be trusted. I can't really drive because sometimes I'm drunk. I can't, I couldn't be on my own. But they got me there, and we talked to Dr. Tabby, and we also met Dr. Restrepo, who's an amazing pulmonologist who just retired. But they finally put those pieces together. And the way Dr. Tabby's explained it to me is it's just something they haven't identified yet for sure. Substance, though, that does respond to the TNF inhibitors. So like the Humira, the Remicade, for some reason, once they get that on board, it quiets down that parasarcoidosis symptoms. And so for me, it was a complete and total game changer. Of course, insurance, it wasn't easy to get everything approved. It took time, and there was a lot of delay. So I think I met her in April of 2024, and that was her recommendation. Also, Dr. Restrepo's recommendation. And then I didn't get my first dose until like the very end of August.
So a dose of what?
So I actually ended up getting Inflectra, which is a biosimilar for Remicade.
Okay. So so I've been down that road. The insurance company likes the cheaper one better, the biosimilar. And so you go and you're in there with everybody else getting chemo, right? And in the chair and getting your infusion, right?
So I actually am really lucky. There is an infusion suites location here. So it's a more private room, which is really nice. I really like it. But they've been just wonderful, and they're in Olympia. So I only have to to drive there once a month, which has been nice. But yes, Dr. Tabby and Dr. Restrepo finally, broke through and were able to get that, get that right treatment.
Multiple letters back and forth
Mhm.
with the insurance
Yep.
company, denial, and then
Yes.
finally they break through,
Yes.
which is
Yep.
unfortunately that's my doctors at the Cleveland Clinic go through the same thing.
Yeah.
Once a year, and then once a year they say, well, you've got to reapply, and then it's
hmm
letters. So hopefully you haven't had to deal with that yet, but maybe you have.
No, I've been really fortunate. Dr. Personaire is my local prescriber. So he's
Yeah.
been coordinating care beautifully with National Jewish Health. It's
Okay.
been really, really a godsend. And he was able to get it approved for me. So he did the work on this end. And then my insurance has just essentially said, okay, yeah, this is going to be a lifelong condition. So they've approved it, I think, to
Great.
like 2099 or something like that. So
Really?
yeah.
What insurance company are you insured through?
So my husband works for the state of Washington.
Okay.
He works for Department of Natural Resources, and so we have a really really nice insurance plan through Regents, the Uniform Medical
Okay.
Plan
Yeah. Well,
there.
you're lucky. You're lucky with that.
Very very lucky.
You're lucky. I mean, I have one of the big companies, and um, we still have to have those conversations fairly often.
Yeah.
So right now you are on the Inflectra, which is
hmm
essentially Remicade,
Yep.
and what else are you taking?
So sadly, I'm still on methotrexate.
Oh,
One of the things we didn't talk about was my eyes. So
oh
my eyes
Lord.
have been, yeah, my
Yeah.
eyes have been affected, and that seems to help with the ocular symptoms. And when I get my scans, it seems to keep things in check there.
What's wrong with your eye? Are you having trouble seeing or focusing or?
Yeah. So this whole process, I've worn glasses most of my life, but it would be all of a sudden like, like, what is this prescription going bad? Or I don't understand. Like, and I actually went back and forth and had different prescriptions through this process, but it seems like the more inflamed my eyes are, the blurrier the vision is, and then my glasses won't work. And then once things settle down, it's good. So it's been a really good indicator to get in and see my eye doctor and have him do the scans. And
Mhm.
he can actually see what's called cotton wool spots in there when they get
Hmm.
inflamed. And every time that's happened, we've just gone up on my methotrexate, one tablet, and it seems to quiet it down within 6 weeks. And it seems to go away. So
Wow.
I don't think I'll ever get off the methotrexate. I would love to, because it really does. That's really what's limiting me from being able to go back to work full time, because you have to
Hmm.
kind of plan for those 2 days of flu-like symptoms from the
Oh, so
methotrexate.
it's that bad.
Yeah.
Like you have the eight body aches and
Yeah.
oh wow, okay. Yeah,
Yeah.
that's much worse than what I was experiencing. Go ahead. I'm just
Yeah.
trying and I think that's valuable information for listeners because methotrexate is emerging maybe as a better alternative than
Mhm.
prednisone in many
Mhm.
cases. There's a
Mhm.
new study out. I reported on it a few
Yes.
months ago.
Yeah.
Um, so interesting that you have to miss a couple of days of work. It's that bad. Are you still on any prednisone also?
So at this point, we have been able to get me down to 2 milligrams. And
Wow, great.
yeah. So it's been the infliximab and methotrexate combo has been very effective.
Yeah.
The reason for the 2 milligrams is it seems like we've maybe wiped out my adrenal glands being on the steroids for
Mm-hmm.
so long.
Mm-hmm.
And so we're really just using it for blood pressure support at this point. I
Okay.
naturally have a really low blood pressure anyway. So the adrenal glands have not adjusted to not having prednisone around.
Usually they come back after the prednisone stops.
Yes, yes. And so I made it down to 2 milligrams finally at the end of March. And so we're only a few months into this, but every time I try to go down a milligram, I'm doing the woo, my blood
Really,
pressure's
really,
low.
just 1 milligram, you can feel the difference.
Yep, yep. It's
Holy
just
cow.
just enough to support the blood pressure. So I see all of my folks down at National Jewish again in July, and I think that's going to be one of the big focuses of, okay, do we try something different, like a traditional Addison's disease treatment like the Fluronef or hydrocortisone. There's other meds they usually use long term if you ended up having no adrenal glands because of another illness.
Hmm.
Addison's disease. So we'll have those conversations. And I feel great being on 2 milligrams though. I mean, that to me, that's a huge success.
Sure.
It's not really doing anything for the Sarc symptoms. It's just a byproduct of it damaging those adrenal glands, I think, at this point.
Well, 2 milligrams, you're not angry and irrational all the time. You're just
No.
not snapping at people like most folks do when they're on high doses of prednisone. Your face isn't all puffed up.
Yep.
So
Yep. Oh yeah. And the 40 pounds of weight gain. I gained
really,
40 pounds on it. I just finally yesterday am back to my pre-illness weight. So I've got the 40 pounds back off.
congrats.
So that's been amazing. But yeah, that prednisone is terrible. It also gave me diabetes. The
Oh
prednisone.
no.
Yes. So for a long time, for like a year of this, I was wearing a glucose monitor and taking diabetes medications. And so I'm thinking, you guys, this is crazy. You don't sleep, it's horrible. The prednisone's terrible. So
Oh gosh. So,
yeah.
once again, and I don't know if you guys just find me because we are kindred souls with sarcoidosis, but once again, you're a backpacker. You're an outdoors person, right? You like to go and challenge yourself
Yes.
physically in and amongst the beauty of nature. And
Yes.
I mean, just yesterday I was rock climbing. I was doing a story
Oh,
for Channel 10, but I was rock climbing with veterans suffering PTSD, and I was loving it so much,
yeah.
just because I was rock climbing, which
Yeah.
I had actually I hadn't done this before, and these guys got me all up on the ropes, and I'm belaying, and oh my God, it was so much fun. But don't you feel like, doggone it, I've done this right. I eat well, I hike, I backpack, I commune with nature. I'm living a good life. I'm not out there eating McDonald's every day
Yep.
and drinking big gulps, and
Don't drink, don't smoke,
I'm
don't.
not doing all that stuff, and doggone it, it still got me.
Yeah.
It's not fair.
Yeah, it's not fair. It's so unfair. I don't know. I think I'm a big proponent of trying to find meaning in the things that happen to you. Uh, Not kind of the default of everything happens for a reason, but more of like these things have happened, so let's find some meaning. And really the best thing I can come up with is it really has just opened my eyes for returning to patient care in the
Hmm.
outpatient setting, of course, safer there being on so many immunosuppressive drugs now. It's safer than being in the hospital with a lot of unknown, really resistant germs. Uh,
Oh, sure.
but yeah, I think it's really opened my eyes to being like, okay, well, I need to make sure that sarcoidosis is in my differential when these symptoms are coming up. I need, like we all know, healthcare providers just it's not something they go to first ever. And it's really frustrating because we all suffer with symptoms for so long before we get any answers.
Yeah.
And so I just try to spin it that way, that that's the meaning behind it. I'm in a position to maybe try to help identify it sooner for patients if that comes across my desk, with a patient that's in
Yeah.
that state.
Yeah. So you are, because you obviously love your work, so you
Oh,
like
I
seeing
do.
patients,
I
and
do.
but you don't see patients in the hospital because let's not expose yourself to too many
Yeah.
drugs. You are on immunosuppressants, which most of us are,
Yeah.
and you have to be super careful. So you're seeing patients 3 times a day,
Uh,
3 days a week.
Yeah, so I was able to return to work in April, so it's still relatively new,
Yeah.
April of this year. I'm working at the rural health clinic that's attached to the critical access hospital out here in our area. So it's a very short drive. It's only 8 minutes for me, which has been wonderful.
Nice.
Trying to kind of modify so I don't get so fatigued with the driving,
Mm-hmm.
back and forth to Olympia. That has been great. The staff have been helpful and wonderful. That's where I did all of my therapy, physical therapy, speech therapy, occupational therapy. So I just kind of kept feeling like I'm getting pulled in this direction, and this can maybe be a place where I can be of service to our community. As I'm sure you're aware, the rural health community is waiting for a primary care provider. I mean, we've got patients waiting 6 to 9 months on waiting lists right now.
It's so hard to attract
It's so
rural
hard.
doctors.
Yes.
Everybody wants to live in the
Yeah.
city. They want to be at the big
Yeah.
medical centers.
Mhm.
I actually serve on the board of a local hospital, and I know, and you know, we're kind of a medium-sized city, but we still struggle. So,
Yes,
yeah.
yeah, yeah. So it's definitely, I think, a good fit for me in terms of being able to help serve my community. And I was fortunate to have disability insurance going through this, so financially we didn't struggle a lot. Obviously,
Mhm.
it's not the same amount of money I was making before, but
Yeah.
we don't really live a very lavish lifestyle. I mean, we we go backpacking for our entertainment, you know.
That's it. That's it,
Pretty
right?
cheap.
Go for
So
a hike. Yeah.
exactly. So we've been okay there, but it's just nice to be able to serve the community again, because I think I told you that in my email. It's a civic duty. I was blessed with the brain and the skills and the education now, to be able to go to serve the community, and you just feel like you're wasting it when you can't do that anymore. It's a very strange feeling. Um,
Hmm.
to just be sitting here knowing there's people on those wait lists, 6 and 9 months. So,
And you've been there too.
and
So now you see it,
yeah,
seen it from both sides. Yeah.
exactly. Yeah.
Have you ever diagnosed anybody with sarcoidosis?
So I get asked this so often
Do
now.
you? Yeah.
Yeah, so in my career, I have only ever met two patients with sarcoidosis at work, like as patients. The
Yes.
first one was already diagnosed, and she was on like a residual dose of prednisone, and that's all I really recall from her case.
Hmm.
And then the other one, I did diagnose, but didn't manage it. As the
No.
primary care,
Right.
of course,
Right.
you're referring to pulmonology. So that was just interesting to me over my career, that just those two. Now, personally, I know two people that have sarcoidosis, but one of them never had symptoms from it. It was an incidental finding. And so they actually were looking because this person had cancer. They had breast cancer. And so they were getting scans done, and they, of course, wanted to biopsy the lymph nodes and make sure they weren't cancer, but they weren't. They were sarcoidosis, which really interesting. So
And if people hear my dog barking in the background, she does this occasionally. I have no idea what she wants, but Shandy has decided that she wants to make herself known to the
nice.
world. Yes. Well, listen, thank you so much for
Yeah.
sharing your story. That's one of the best walkthroughs or descriptions of the trauma that anybody can face going through the diagnosis process
Yeah. Yeah.
that I've ever had on the podcast. And I'm sure your background in medicine really helped. But I'm glad to hear you're feeling better.
Yep. Yep.
And
Went on a hike yesterday with my friend
great.
Stephanie. We did a full mile, and it was wonderful. So I'm
Okay.
slowly reintegrating into my old life.
And I'm
Yeah.
sure a mile is mild compared to what you've done, right? I mean, if you go
Oh,
backpacking,
definitely.
you go out
Yeah.
and do 10 miles, right?
Yeah, yeah, absolutely. And that's, John, that's what's so crazy about this. In April of 2024, right before this happened, my husband and I celebrated our 25th wedding anniversary, and we decided to go to Sedona, Arizona, and we hiked all over there. I'm sure you're familiar with their they just have the best trails there. They're
Sure.
everywhere. We just had such a great time, climbed on the rocks, all of the gorgeous rocks that they have, and was probably in my best physical shape in adulthood. And I mean, so we had my son with us too, and a friend, one of our lifelong friends, Greg. He's just amazing. He always tags along. He's not married and doesn't have kids, so he tags along when we go on these adventures. And they couldn't keep up with me. I'm just cracking up because I'm going ahead of them, and I
Wow.
just thought, this is great. I'm beating the guys, and these are on some like double black diamond biking trails. You share the trails with the bikers,
Right.
and hard stuff. And I'm ahead of them, and I'm
On
thinking,
the
this,
Red Rocks, right?
yeah, on the red
Yeah.
rocks. Yeah, I'm
Yeah.
like, this is great. I'm loving it. And then to just be completely have that life hijacked 6 weeks later, it was just nonsensical. It made no sense.
Wow.
So
You never
yeah,
know. You never
yeah,
know.
you never know. Yep. So it's nice to start reintegrating slowly but surely.
Yeah. Well, Heidi, thank you for sharing your story here today.
Yeah.
I hope you have continued good health, and that the medications continue to work, and that you got this thing controlled, and
Yep.
you can resume your life as a nurse practitioner and as an outdoors person and a mother and wife and
Yep.
all those things, because I know that's all important to you.
Absolutely. Yep.
All right. Thank you.
Thanks, John.
I feel like a zombie, just feeding and stumbling.
Thanks to Heidi for reaching out. You may have noticed she credited the podcast for helping her arrive at National Jewish Health for her treatment with Dr. Jenny Tavy. Dr. Jenny Tavy has been on the show as well, and Heidi mentioned that. In fact, I think Dr. Tavy was on as a guest. I knew she was on as a guest, and she may also have appeared as part of a panel or something that FSR put on, because she's very active with FSR. So Dr. Tavy is well known to the listeners of this podcast, as well known as anybody can be, if this is what you're using as your metric, the podcast. But Dr. Jenny Tavy is wonderful. Episode 48, and I'll put a link to that episode in the show notes, or you could just as easily Google the Sarc Fighter Podcast, episode 48. Dr. Jenny Tavy, Jinny Tavy, Tavee, and I'm sure it'll come up for you. But by the way, I'm so glad to hear that Heidi is up and around again. She's working again, and you heard her say that is her passion. She loves serving her patients, and now, because she is immune suppressed, she didn't want to be in a big practice with more and more germs that, who knows what. So she's a solo practitioner. She's serving a rural population, and I will bet you dollars to donuts that the folks in that area are so happy to have a local practitioner. So once again, thanks to Heidi for sharing her story here on the podcast. Good time to contact me. I need guests for the summer, so if you'd like to share your story on the podcast, I would love to hear from you at carlinagency@gmail.com. Love to hear from some caregivers, or if you're a patient, maybe kind of nudge your caregiver and say, you're really taking good care of me, and I know it's been hard on you, and there's a lot of other caregivers out there who would probably identify with what we are going through, and maybe it's your time to shine. So I'd love to hear from some caregivers. Also would love to hear from more veterans. But really, if you're out there and you are dealing with sarcoidosis, just like Heidi did, reach out to me, and let's get you here on the show so other people can benefit from everything you've been through. The official Sarc Fighter song is Zombie by Mark Steyer. Hear Mark's story behind the lyrics in episode 12 and also in episode 118. As I'm speaking today, my trusty dog Dougal, a boxer, is curled up in the chair in my office. Shanty, my adorable rescue mutt, has snuck off and she's sleeping on the bed, but she's not far away. If you're new here and you're just trying to figure out what Sarc is, listen to episode 2 with Dr. Simon Hart. My story is episode 1. Please send me an email, carlinagency@gmail.com. And until next time, keep fighting.